Hey, EO Alive TV. We're glad that you're here today. And we've been away a couple of weeks, but it's good to have Carrie with us, who is like one of the busiest people around, I know, dealing with everything that's going on. Um, Good to have you with us. How are you doing, Carrie? How are you surviving all this?
I'm doing good today. Thanks for asking. Obviously, we're still pretty busy over here at CHD and public health, and you all see my face in these interviews, but there are quite a few people working behind the scenes on a daily basis, very diligently, working very long hours to continue to do the work of public health that we've been doing all along through this pandemic and our COVID-19 response. So we're busy, but we're definitely still doing our best that we can to accomplish what we need to do to help keep our community safe and healthy.
Good. And I tuned in to the Zoom webcast last night with Jick, and I thought it was really good. I appreciated the questions that were proposed to the different leaders, because there was some information there that we didn't really have, or some answers to the questions that really hadn't been that lots of people were asking, but just didn't have a place. So it was good. How did you feel about that?
Yeah, I agree. I think it was a really nice forum for all of us that were there to be able to answer some of the frequently asked questions, so to speak. And I know our community really wants information, and we do our best to share that information, but sometimes we're sharing it in different places and people don't always know where to look, or they'll comment on one post trying on our Facebook trying to get information that we shared on the last post. And so just having one location where people can go and get information from those different community leaders is, I think, really helpful. I was glad we had the opportunity to do that.
Good. And I was glad that Jeremy Davis was there, and some of the information that he shared, because because of the restrictions that they have to deal with, some of that information has not been publicly known. And so it's kind of hard to know, how is the hospital doing? You're kind of in the dark a little bit. And I understand why that is, but it was just, good to hear him. I mean, the thing that stuck out for me is when he said, we've had more babies being born this year than we've had actual COVID cases at the hospital, which still, even given the amount of active COVID that we have in the community, that's a pretty good thing.
Yeah, I agree. I was actually really glad to hear Jeremy's responses to the questions that were posed to him as well. I think we are regularly getting inquiries about hospitalizations, and I understand that these are questions that are coming from really good places. People, first of all, really care about the residents of our community and want to know if people are severely ill or if they're able to manage the virus at home and with minimal symptoms. They really care genuinely about their community members, and I think they also are concerned about the hospital's capacity to take care for the community, to take care of the community. And I've never had any doubt that the hospital has all of the plans and resources in place to be able to take on a significant influx. But I think having Jeremy be able to share some of the reasoning behind why the hospital makes the decisions that it's making around this, and to, again, have some of those really concrete barriers. And I'm so sorry, I didn't turn my ringer off. I apologize so much. I get a lot of phone calls these days.
That's all right.
Anyway, I think it was really nice to be able to hear that perspective. And again, all of us are coming from a good place, and we all want information because we care about our community. So again, just a nice forum to be able to share that.
Yeah. Well, let's talk about just the overall picture. So we have over 300 cases in the area. We've had over almost 1,000 tests that have been done. I don't know. how do you think we're doing, given our situation, given that we genuinely had an outbreak? I don't know. Where do you think we're at?
Yeah, I think, obviously we've had a lot of activity over the last few weeks, and we were just kind of sitting back and reflecting on the timeline. And, it feels like the last two or more weeks have been a much longer period of time than it's actually been. Just quite a lot of activity during a short period of time. I noticed today that the Oregon Health Authority, when they released their daily press release that they send out, that today we had 281 cases of COVID-19 reported, which is the highest number that we've seen in the state so far. So I think that, we definitely had a surge in cases here in Union County, as everybody's aware, but we've also had a consistent number trickling in every day. And, that obviously has something to do with the fact that we're really trying hard to, identify contacts to confirm cases and get them tested. So again, people that had a true and concrete exposure risk, we're definitely trying to test them. So, over the last few days, we've seen 5 to 10 cases pretty consistently. And, I think we'll anticipate that people are, those initial group of people that we tested and came back in a matter of 2 days, we'll continue to see contacts to those individual cases as we move forward. But I think it definitely gives our community the information to know that the virus is here in our community, and that the information that we've been sharing all along is relevant here. I think it's human nature. I have the same thoughts, and I early on when, I would sit here and tell you all the prevention messages and, all the information that we've shared throughout this whole outbreak, but we had such a small number of cases. I think it's really easy to say, well, yeah, but, we're not seeing it here. But, I think there's no doubt that it's here now. And so I think that it just helps us really recognize how important those preventive measures are. And, hopefully we can just keep taking those actions that allow us to mitigate the spread. I think that, if you were talking about the meeting that we held last night, our county emergency manager has talked pretty consistently about what success looks like with this. And, we go back to the very beginning, which is that we needed to flatten the curve to maintain our hospital capacity. And so again, as long as we're able to care for the people that are ill, that's what we need to be able to do. But in order to do that, we have to continue to keep the rate of transmission low. And that is in the hands of our community. Like, we have the power to make that happen.
Well, and one thing that was good about hearing from Jeremy is that, we're constantly hearing from national media how other areas, hospitals, are being overrun. They don't have the capacity. And so it was just good. It was good for him to assure us that that's not the case here, even in spite of the outbreak. That's not what we're experiencing. So talk for a minute about, there's been a little bit of confusion about, if somebody is negative or if someone's positive or if they get a test, what are the procedures? What do they need to do?
Yeah, and I have said this before, and I'll probably say it again. I understand why people are confused, because sometimes I'm even confused, and I have to go back and look at the Post-it note that's on the wall in the room that I've been sitting in to remind myself of what the guidelines are, because we are asking people to do different things based on their own situation. So what we do believe is that this disease has a average 14-day incubation period. So if I was exposed today, like let's say sitting right next to me was a person that had the virus and they gave it to me, I may not know that for a full 14 days. I may not have symptoms develop, and I may not have the virus, present in me for that full 14-day period. So what that means is that if I let's say I go get a test in a couple of days and it comes back negative, that doesn't mean that I wasn't exposed on that, 2 days ago. So we really need people to basically wait out that full 14-day period unless they get a positive test. And then if they get a positive test, then we have a more concrete guideline to give them. So, if I'm negative, regardless of what, if I was a contact to a confirmed case, again, if I have a real risk of contracting the disease because I've come into contact with somebody that has it, I really do need to wait that 14 days, even if I get a negative test result. And I think that's hard to understand. I think it's sometimes even hard. It doesn't make sense sometimes. Like I got a negative test, I should be good. Well, there's still a chance that you'll develop the virus within that 14-day period. So you just need to stay home, stay away from other people, quarantine yourself until you've passed that period of time, and then you should be good. If you get the positive test result, it's a different story.
Well, and it's funny. I think the NBA, they're in the plans of starting some kind of a season, and I think one of their requirements is that the players all have to have three negative tests, because there are false negatives. Excuse me.
Right.
And the reason I understand is that the virus can be in your body, but maybe it's not at the back of your throat or the back of your nasal passage where they test it. And so it can take a while to accumulate there. So somebody asked me this question. This came in on Facebook. Somebody lives in an apartment complex. Somebody in their apartment complex tested positive. They don't know who it is, but this person does social distance. She wears a mask. She washes her hands constantly. And as far as she knows, she has not contacted. She's been responsible. Would I be safe to keep going to the store and make my appointments? Am I at high risk? Which this is a real practical question. What would you say to them?
Yeah. So, again, I would say that we're pretty confident that the physical proximity is really important. So, if you were living in a apartment building with somebody else, but you were never sitting in the same room with them, your risk is honestly, I don't even know that I would consider you to be at risk at all. Is there a chance that you could touch the same surface as somebody else? Maybe, but if you wash your hands like you said you were doing, I know the first thing I do when I walk into my house is wash my hands, and then depending on where I've been, I also clean off my keys, and I make sure that I wipe down any of the surfaces that I touched. So again, if I bring the virus in with me, anything I came into contact with, I'll be very cautious. So again, I think if you're taking those preventive measures and you have not been in that close contact with that person, which we define as within 6 feet of somebody for 15 minutes, then you should be good. So again, high risk is really going to be the close proximity to somebody that has it.
Thank you. So let's talk about masks. So now it's required, and specifically, if I'm understanding right, it's required in public indoor spaces.
Yes, correct.
Yeah. So I don't know. Talk about that. I mean, so some of these things, it seems like we have hammered to death. We've been hammered to death on it, but I don't know. For those that really think that maybe it doesn't matter or it's not effective, or I don't know. Talk about it a little bit. Give us the pitch again.
Yeah, well, we have talked about this a lot, and I understand that people have different opinions about their, whether or not this is an effective strategy, and all, whether or not there's so much information out there, right? And so I think it again, one of those things that can be confusing, but we really have started to have research and studies now that show us that the face coverings do prevent the spread of the virus. And, I think, again, as I've said many, many times before, this is really to protect the people around us. So, if I put on my cloth face covering, which I have in my bag, that's right next to me and I always have with me, I'm in a room by myself, so I'm not wearing it. But I've been working in a room with other people, and even though we're physically distant 6 feet or more apart from each other, I'm still wearing it when I'm in that environment with them, because again, I just want to keep them safe. Like, I don't want to take any chances. And, even though it may not protect them 100%, the fact that we're doing all of those things in combination is really going to make our risk of infecting each other relatively low. So, and if you think about it, it really does make sense to me. This is a disease that is spread through droplets. The droplets go through the air and they hit the thing. So when I'm sitting here talking, the droplets are coming out of my mouth and I can't see them, but they're hitting my computer screen. I have no doubt. If I'm wearing a mask, the likelihood that those are going to reach the person that's sitting across the room from me decrease. And so again, when we don't want to take one strategy and rely only on that. We want to put all of these tools that we have in our toolboxes together and reduce our risk. So the face coverings are, we want to physically distance though. We've got to wash our hands. Like, all those things still have to happen. But I know that when I go to the grocery store, or I go to do some essential things that I need to be doing, I go to the post office, whatever it is that I need to do, there are definitely going to be scenarios where I may not be able to maintain that physical distancing. And so by wearing the face coverings in public spaces where we're not able to maintain that distance, it really is, again, just one more tool we can have in our toolbox to reduce the spread to each other.
So for businesses in the area, and I think I understand this from watching the Zoom conference last night, businesses can refuse to service someone if they are not wearing a mask. And I mean, I guess that would be up to the individual business to do so. But on the same hand, the police are not going to come and give you a ticket. In fact, Gary Bell said, please do not call 911. If you find someone that's not wearing a mask, don't call us about this. We've got other things that we need to deal with, and so so somewhere in there's a balance. You're right. At the end of the day, it's it's a consideration to the environment that you're in. We did a shoot not too long ago, and we were in an office, in our own little office. I mean, there's just two of us that work together regularly, and so we're essentially a family unit. We've been together for a while. If we're going to catch it, we will have caught it between us a while ago. But when we were going into another environment, we both wore masks. We were both very careful. When I was putting the microphone on the person, I tried to be very careful, and so on and so forth. So it's just a matter of being considerate in the environment that you're in.
Yeah, and I really want to also acknowledge that it is not going to be appropriate or practical for every single member of our community to wear a face covering. It's just not. And so this shouldn't be about us, judging other people because they are or they aren't. Again, the recommendation is that we do this, and we also have to understand that there may be some people that can't. So it's not about going after somebody because they do or they don't wear one. It's just about saying, like, this is what I can do as an individual. And last night I went to grab some dinner, and I was wearing mine, but my kids weren't wearing them because they're, 12 and under. And honestly, I haven't been able to find one that fits them exactly the right way. Right. So, again, there's going to be people walking around that may not be wearing them for whatever given reason. And so I feel like it's, it did come up on the meeting last night. Like, this is a time for us to come together and protect each other. And sometimes that's going to be meaning that I get to, and I can, and I'm able to wear a face covering, and I'm going to choose to do that today. This isn't about, getting upset with people that don't, or, calling the cops, calling 911 because somebody was in a business. And, I think if a business owner feels like it's very important that their patrons wear one when they're in their business, then they get to make that choice, and that we need to respect those individual decisions. But again, this is really just about us coming together and doing everything that we can to keep each other as safe as possible and limit the spread. Again, going back to that original objective of making sure that we don't overwhelm the capacity of our system to take care of people that contract the virus and become ill.
Yeah, thank you. Well said. And I personally, I get weary of the shaming. There's just a ton of shaming going on right now, and it's not a good motivator. I mean, shame works. It's counter relationship. I mean, if you shame someone for very long, it's not very long before they're going to want to distance themselves from you, and they don't want to be in a relationship with you. And we're really at the point where we just need to tackle this stuff together. And so one of the organizations that, and this is a couple of months ago, I actually attended a funeral, and this was before there was the big push for face coverings and so on and so forth. But they made it really easy. I mean, they had a pile of them there. And it's like, hey, it's important to us that you do this, and we will provide one for you right here. So they eliminated the excuses. And I thought that was very welcoming. That was a way of handling the problem. So,
yeah.
Anyhow, well, so we had a ton of cases all at once with this outbreak, and since then we've had, 5 here, 10 here per day, and certainly we are the cases are increasing. But it seems like, I mean, we're not getting the big chunks. And so I guess I'm kind of interested in knowing, what does that indicate to us? Do you think, are we quenching? Do you think we're quenching the outbreak? I don't know. Do you have any indication, any gut about any of that?
I think that there's so many factors that go into this. I think it's really hard to make an assessment. Obviously, we tested a large number of people over a short period of time, and a lot of those individuals did happen to come back with positive test results. So we had a couple of days where we had this very large number of cases. And then, now our testing has been somewhat spaced out. We did have a second large testing event where we had a lot of people come and test. But one of the things that I've been grappling with is that, we have talked about the fact that sometimes when you do the test makes a difference in the result that you get. And so if you don't, if you hit somebody like a couple of days before there's enough virus in their system to be detected, they may still come up with the virus. So, you do this 2-day testing event, and, one testing event, you get quite a few people that are positive. One testing event, you get, a couple of people, not a couple, but, a smaller number of people. But then, you follow up with some of those people that had negative test results 2 to 5 days later, and some of them have developed symptoms at that point. So then if you went back and you tested them again, would you get positive test results? So, a lot of this is just that, we need to take the case counts, the number of cases that are being reported out each day as one piece of data. And again, I've come back a lot to that hospital capacity. I think that's another thing. Like, we've had our eye on, what's going on in terms of people accessing care throughout the whole thing as well. And again, we may have people in our community that are symptomatic, and they're doing exactly what we've asked them to do all along, which is if you have COVID-19 symptoms, stay home. And if you are sick enough that you would normally contact your healthcare provider, then go ahead and give them a call and see what they recommend that you do. And of course, if you're sick enough to need to go to the emergency room, we want people to do that. But, I think, again, there's so many factors that play into this that the numbers are just one piece of information that we have to look at.
Good. I'm hopeful. I mean, I do hear of, people, individual cases, people getting it through contact tracing that they didn't expect to get it, and I guess one personal question I had, or one question. So let's say that, let's say that let's say that I'm tested positive, or let's say, sorry. So if I'm tested positive, and then we go through the contact tracing efforts, and specifically that is who you back up to the point where you had your first symptoms, and then from that point on, that date on, I have to write down everyone that I was within 8 feet or closer of for more than 15 minutes. Maybe it's 6 feet or closer. So then those people that are contacted through that contact tracing, are they supposed to stay home for the next? Are they isolating themselves? And how far down the chain does it go?
Yeah.
Yeah, I mean, and I guess I'm a little unclear as to how many generations down the road are people supposed to isolate?
Yeah. So, I think I've talked before about how we really shifted our strategy in the state of Oregon. So initially it was like everybody stay home. And now we're just going to ask the people to stay home that absolutely have a risk of contracting the virus. So we will ask you for up to 48 hours before your symptoms develop. So we actually are trying to get a little bit before you became symptomatic, because we think there could be transmission during that period of time. We'll gather that list of people, and then we will, again, call them. And what we recommend they do depends on what they tell us. So this is where it's really hard to give a black and white answer. So if one of those people had no symptoms, they were totally fine, we would ask them to quarantine for 14 days after their last known contact with you, the close contact. Then if they develop symptoms, then it would be different instructions. And again, we're monitoring those people throughout that 14-day period to see if their status changes. And then obviously we change the recommendation. If they develop symptoms, then they need to stay home for 10 days or quarantine or isolate for 10 days, plus 3 days fever-free and significant improvement in symptoms. So, and then again, if those people have been tested, they're going to get a different direction, which is, again, why it's very hard to give really concrete black and white answers in this situation. And we're really relying on people to follow the directions that they're given by public health. But I think that there's no doubt that if you have symptoms of COVID-19, you really need to isolate yourself from your family as much as possible. You shouldn't be going out in public. You shouldn't be going to get your groceries. You just need to stay away from everybody else so you're not going to transmit the virus to other people. And again, if you wait 10 days from the day those symptoms develop, and then you also have 3 days without a fever and a significant improvement of your symptoms, then that's when we would say that you're probably okay to go back out in the community. But, I've been thinking, as you were talking earlier, so much of this feels outside of our control. It's felt like such a whirlwind to me in a lot of ways. And I feel like at this point in time, we do have some control over what happens at this point. And the way that we control what happens with this virus in Union County is by, doing all the things, staying home if we're sick or symptomatic, I should say, washing our hands, physical distancing, doing all of the face coverings, all the recommendations that we've been providing all along, that's we get to take control over what happens. We can change how much virus we have in our community by doing those things. And again, I feel like it makes me feel like it does give me hope. You said you had some hope. It does give me some hope and reassurance that like the power is in our hands, even though sometimes it may not seem like that when we're dealing with something that's invisible like this.
Well, and I think that that's absolutely, I mean, so rather than people hibernating and living in fear, they certainly have the option of going out hiking when they're interacting with people, keeping their social distancing, putting their mask on if that makes them feel better, and so on and so forth. But you know, there's a little bit of cabin fever sometimes that goes on, and you know, I get the idea that sometimes the only life that some folks has is commenting on social media, which is like I mean, it's a little bit of craziness, which then leads me to my last question, so I can let you go, and that is, are you still walking your dog? And
Yeah, you know, it's funny. We live in such a beautiful place here in Union County, and there are so many opportunities for us to go out and about. And last week, the weather started getting a little bit warmer, which was like really so exciting for me. But I haven't been as good about getting out in the woods as I normally have been. And so I'm going to make that a priority for this weekend. I will definitely be on Mount Emily giving my dog a good run. And I have been reading a little bit on my downtime, so that's equally enjoyable to me. I'm okay doing that too, but I will definitely be on the mountain this weekend.
that's good. You know, I was thinking the other day about pets and children, small children particularly, they kind of come into the same, and that is when you spend time with them, you know, their world is just right now. A dog's not thinking about the future. A toddler's not thinking about that. They're just thinking about, I'm hungry, or I want to crawl on mom, or I don't know, whatever the case might be. And it has a way of grounding us as people. It has a way of, like, for me personally, it pulls me out of the video project that is maybe running behind, or you know, the email that I didn't respond to, or whatever it might be. And we spend so much of our life trying to figure out what's going to happen tomorrow that we just kind of lose sight of some of the things that are really joyful right now. So
Yeah, absolutely.
yeah. Well, Carrie, thank you so much for taking the time. And I know you guys take a lot of heat, and uh, you're the messenger so much of the time, and the comments uh, on social media. There's many of them that are giving shout outs to you and appreciate what you guys are doing. And again, those of our audience members, if you have questions that are not answered, at least in our posts, we often put the email address of the local JIC, and they can get those questions to the right people and hopefully get them answered for you. So thanks a lot. And EO Alive, thank you for jumping in with us today. And we plan on being here next week at the same time. Thanks so much.